You're listening to the Dental Zone podcast. I'm Dr. Rachel Hall. This is the place that supports you to understand your dental issues, the causes and how to prevent them, empowering each individual to get the most out of life while bearing a stunning smile. Hello, I'm Dr. Rachel Hall, holistic dentist from Brisbane, Australia. Welcome to the Dental Zone podcast. Thank you so much for joining me. This is the place where I like to share my wealth of expertise and knowledge on all things holistic dentistry, on how your dental health impacts your overall health and vice versa. And I'm here to support you to have a healthy life and a healthy smile and to know exactly how to care for your teeth and gums beyond brush and floss and don't eat sugar. If you want to know more, you can hop on over to holisticdentistry.au or check out my dental practice website, evolvedental.com.au. But before you disappear, stay with me because we're going to get in the zone. And today I'm going to talk about the things that you need to have strong teeth, and specifically the 6 supplements that you should look at taking or including in your regime to help you have strong teeth and healthy gums by a little bit of a byproduct. So let's get to it. Let's get in the zone. So there are some things that you can do if you want to have fewer dental cavities and therefore less trips to the dentist and less fillings. You really need to focus beyond brushing and flossing, cleaning your teeth and your mouth. Yes, they are super important, but if you don't have all the pieces of the puzzle, even if you brush and floss really well and really regularly, you can still be at risk of getting decay if you don't focus on your diet, get that right, and then utilize maybe all 6 or some of these supplements to help you have stronger teeth. Now, there's a lot of hype out there in internet land regarding healing dental cavities and reversing dental decay or reversing a cavity. Now, there's blogs and videos that would make it appear that you can eat your teeth better and then avoid having to see the dentist when you've got a hole in your tooth or an infection. And I'm here to tell you that's a myth. That's not true. If you've got decay that is through into the next layer of your tooth, which is the layer underneath the enamel, which you can see, then that decay needs to be treated by the dentist, and there is nothing you can eat, drink, consume, put on the tooth that is going to stop that decay from advancing. And the same if you've got an infection that needs to be treated. But then let me kind of confuse the issue a little bit, because there's a point in which you technically have tooth decay whereby you can still heal and reverse it. So the information about being able to fix a cavity is misleading and inaccurate. Once you've got that decay in the inner layer of the tooth, only dental intervention can help. But this is where it does get confusing, because if you have a very superficial cavity, which is actually what we call demineralization, or kind of like the enamel layer, the outer layer is dissolving, then this can be rehardened. That can be remineralized through improved oral hygiene and dietary changes and by taking it supplements. So let me make it really simple, because I don't want to lose anyone here. A superficial cavity where there is demineralization or chalkiness of the enamel can be reversed, but a bigger cavity into the inner layer of the tooth cannot, and that needs to be treated by a dentist to prevent the decay spreading and damaging the nerve or destroying your tooth beyond repair. So if you can remineralize teeth, can you make your teeth stronger? Well, yes, you can. You can do that by diet and supplementation that will remineralize the enamel and make that layer stronger. So nutrition, or let me be more precise, inadequate nutrition, is the foundation of nearly all the problems that people have with their teeth and gums. But then the good news is this is also then the key to the reversal of those problems. So I'll often see patients who they'll come in and they tell me they've got chalky teeth, that they've got, every time they see the dentist, they've got decay. They brush and floss, and I look around their mouth and it's relatively clean. There's not a lot of plaque and tartar there. Their gums in good shape. I can see that they're doing a good job. Then we discuss their diet, and they always say, and everybody will tell the dentist, I don't have a lot of sugar. And I'll go, okay, fair enough. What do you mean by sugar? And we get down to the fact that they're talking refined sugar, sugar in tea and coffee, chocolate, lollies, sweets, candies, that sort of thing. But then when we get to the more nitty-gritty of their diet and we look at maybe they're having processed foods, packaged goods, and we talk about all the hidden sugars, and then they start to realise, hang on, maybe I do have more sugar than I think. Then there's naturally occurring sugars, so in fruits and citrus, in starchy food, and those sugars can be converted by the bacteria in your mouth so that they can cause decay. When we start looking at that, they go, actually maybe my nutrition's not as on point as they think they are. And this is where we then have a conversation about, you don't have to radically change the diet, just a few little tweaks and changes, and then adding in some supplements to help support their body. So if we want strong, healthy teeth, then we've got to support the remineralization process that the body naturally undertakes in order to keep your teeth strong and healthy. But just like any other process in your body, for your teeth to remineralize, it needs the right nutrition to work and run smoothly. And similar to other parts of our body, sometimes our teeth will need an extra nutrient boost, and this is where certain supplements can naturally help you remineralize, strengthen your teeth, reduce your risk for tooth decay. So let's have a look at these 6 supplements to help strengthen and remineralize teeth. And I'm just going to run through them one by one, give you a little short synopsis on that, and then you can have a look for yourself. Maybe do a bit more reading, a bit more researching, listen to some of my other blogs, listen to some of my other podcasts, check out some videos or blogs, and then see what works for you. So my number 1, calcium. Yeah, you probably all guessed I was going to say that because your teeth, as you should know, are made from calcium. It's one of the major building blocks, and we associate calcium with strong, healthy bones and strong teeth because this is the primary building block, but we also need it for proper teeth remineralization. But calcium's a bit of an odd and tricky or awkward nutrient to get right because if you aren't effectively absorbing it, it can be very quickly rendered useless, and it's just not doing what it needs to do. So if you are going to take calcium, don't do it on its own because it can run wild and it can end up in the wrong places in your body. Like it can get into your arteries and start calcifying your arteries, which is not a good thing because your arteries are nice, soft, flexible and stretchy. So you need to supplement with other nutrients to support that calcium intake, absorption, and getting it to the right places. So we need the right mineral combination, and I would say that specifically vitamins D3 and K2, they both absorb and direct the calcium to its intended endpoint, its destination. So the D3 and K2 help you bring it into the body and help you transport it to the exact place where it goes. So I would recommend about 1,000 milligrams of calcium per day with D3 and K2 to help remineralize your teeth. So that segues us in nicely to supplement number 2, which is vitamin D3. Now, vitamin D is possibly one of the most important nutrients, not just for your teeth, but for your overall health. Now, it's been a bit mislabeled because it's not actually a vitamin as such, it's more like a hormone. And because of this, there are receptors for vitamin D on every tissue and organ and cell throughout your body. So when it comes to teeth remineralization, D3, which is a fat-soluble vitamin, is needed to properly absorb calcium and balance minerals throughout the body. Now, these two processes, The absorption and balancing is very critical for the formation and repair of your bones and teeth. They're also responsible for helping your teeth maintain their structure so that they last your entire life if you take care of them. Now, sadly, about half the population is deficient in vitamin D for many reasons and will often need to supplement with it to ensure adequate intake. Even if you live in a sunny climate, you can be vitamin D deficient. Now, these levels can be low because we get less sunshine because we spend so much of our time indoors. And in my opinion, and not just my opinion, but many others, we're overusing sunscreen. Now, I'm not for you getting your skin burnt, but you should have some natural skin exposure to sun without sunscreen on for a period of time that you can manage where your skin doesn't burn. So here where I live in Queensland, Australia, in the summer the sun's very intense. I've got relatively fair skin. So for me, 20 minutes in the sun, that's enough without sunscreen. Once I've built a base tan, I can go a little bit longer. The key is not to get burnt. So we need some sun exposure. The other reason we can be low in vitamin D is because we consume foods that contain too much phytic acid, and that interrupts your vitamin D metabolism. Now, some of those foods include almonds, hazelnuts, legumes, so like lentils, beans, soybeans, hazelnuts, if I haven't already said that, grains, and sesame seeds. So I'm not saying don't have those foods, but just be aware that if you do eat them in a regular basis or in fairly high quantities, it has the potential for interrupting your vitamin D metabolism. Maybe just want to move away from them a little bit if your vitamin D levels are low. And then my recommendation for supplementation is vitamin D3, not the D2, because the D3 is easier for your body to utilize and use. And I recommend about 1,000 IU or more each day. And again, any supplementation, I would recommend you discuss that with your GP or with a naturopath so that you make sure you're doing what's right for you and your body. These are just kind of some rough guidelines to give you an idea. Supplement number 3 for strong and healthy teeth, vitamin K2. Now, your D3 needs to be paired with vitamin K2. They work synergistically, hand in hand. They go together to improve your calcium absorption and distribution. D3 is responsible for better absorption of calcium, while vitamin K2 works to direct the calcium throughout the body. Vitamin K2 is needed to activate osteocalcin, which is a protein that is needed for the dentine matrix, which is the inner part of your tooth, and it's needed for repair and growth. And it also works with matrix GLA protein, which helps to remineralize your teeth. So you can see that vitamin K2 is important for you to have the building blocks, and it's important for you to have the remineralization and actually get the calcium from A to B. So I recommend supplementing with about 90 micrograms of vitamin K2 per day, and make sure it is K2 and not K1 because they do very different things. Let's move on. So far we've got calcium, vitamin D3, vitamin K2. I'm also going to say you need to have magnesium. When it comes to remineralizing your teeth, magnesium is necessary and super needed for the structural development of the teeth, and it also determines how effectively your body will absorb calcium. Having too much calcium in the body, as well as vitamin D and phosphorus, can lower your magnesium levels, which can hinder the remineralization process. And this is why it's important that you supplement these nutrients in balanced quantities. You can't take calcium without magnesium. You need the two together. And then for them to get where they need to go, you need the D3 and the K2. So just like vitamin D, about half the population, and I would say probably tending to more like 2/3 now, are not getting enough magnesium. So there's a good chance you could use more of this important mineral in your diet. And look, it's not just about your teeth here. Magnesium is needed for about 70% of your biochemical processes to work. So for your body to function, it needs magnesium. Now, I recommend taking between 300 and 400 milligrams of magnesium a day alongside the proper amounts of calcium, vitamin D3 and vitamin K2. Now, I'm really lucky where I live. I have a beautiful swimming pool and it's what they call a magnesium pool. So it uses magnesium salts to help keep the water clean and up to scratch. But that means that when you're swimming in it, you're actually absorbing magnesium into your body. It also leaves your skin and hair feeling really nice and doesn't dry you all out. So there's different ways of getting magnesium. You can take it orally as a tablet or a powder form and mixed up in liquid. You can apply it via sprays and creams onto your skin. But essentially we just don't get enough magnesium. So that could be a whole new podcast just on its own, couldn't it? And I'm just sitting here wondering, is that something we need to talk more about? Anyway, back to your teeth. Collagen. That's really, really big topic at the moment. In the last couple of years, collagen has become something that we're talking more and more of in kind of complementary health circles, keto, that sort of thing. Throughout your life, your teeth are going to be constantly being worn down. Now, most of that wear is microscopic, and through teeth remineralization, your teeth are constantly being built back up. But your teeth are made of different parts. So you've got your enamel, that's the outer hard layer, the dentine, which is inside, and then under the gum, you've got the root face, you've got the roots of the tooth, and that's covered in a material called cementum. And then you've got the bone that kind of holds the teeth in, and they all have organic and inorganic components. Now, collagen is a major part of the organic aspect, the more kind of fleshy aspects of the teeth. In fact, type 1 collagen makes up about 90% of the organic components of your dentine, the cementum on the roots, and your bones. And then there's type 7. Roman numerals, give me a moment. Type 17 collagen, XV11, if I've written that down correctly on my crib notes, is essential for enamel formation. And without enough, there can be tooth malformation. So while you're in utero, while you're developing as an infant, while your teeth are growing in your jawbone, which is usually complete by around the ages of 6, 7, 8, apart from the wisdom teeth, you can get malformed teeth because there's not enough collagen in the body to create the scaffolding for everything to mineralize and grow upon. Now, collagen is mostly found in animal products, especially the connective tissues and organ meats, and we don't really eat much of that anymore. And this makes the argument for collagen supplementation quite strong, and it makes it a good idea. Now, an added bonus is that collagen is good for your gut health. It's high in glutamine, and it even helps repair leaky gut, which improves your nutrient absorption. Now, there are many different collagen sources, but grass-fed cattle sources are the best because they're going to be the highest in type 1 collagen. Now, you can either do that through food, or you can do it as I do through supplementation, because I just find that works better for me. And then whilst this isn't necessarily a supplement, it is definitely an adjunct and definitely something that is very crucial for you to have good oral hygiene, strong teeth and strong gums. And this is supplement in inverted commas, quote marks, number 6, oral probiotics. Now, I'm not talking about taking oral probiotics where you swallow probiotics for your gut, but these are probiotics specifically designed for the oral cavity, specifically designed to recolonize your mouth. So you've probably heard of the gut microbiome, but very few people understand or have heard of the fact, but it's starting to become more mainstream now, that we also have an oral microbiome. And I've got some blogs on this on evolvedental.com.au if you'd like to check them out at a later date. And I think I definitely need to do some podcasting on this. This oral microbiome has a large component of bacteria held in their salivary bath. And studies have found that people with higher inorganic components in their saliva, including things like calcium phosphate, and who have more acidic pH, are at higher risk for gum disease and tooth decay. So if you've got high inorganic components like calcium phosphate, you're more acidic, you're going to get more risk for gum disease and tooth decay. Your saliva is meant to actually have compounds in it and be alkaline to help neutralize and remineralize, neutralize acid and then remineralize your teeth. And we also need to have a balance of good bacteria to help suppress the bad bacteria or the harmful bacteria that cause gum disease and tooth decay when they get out of control. So the probiotics increase the organic compounds of the mouth and saliva, and they counteract the effects of the inorganic compounds, and they have been shown to improve bad breath, reduce symptoms of gum disease, decrease inflammation, even possibly prevent oral cancer, and help you combat tooth decay. They work to kill the harmful bacteria that cause tooth decay, and these bacteria, the harmful ones, will inhibit teeth remineralization. So probiotics going to give you what you need. They're going to recolonize your mouth. They're going to help you remineralize your teeth. So I want you to get one from a reputable manufacturer. It needs high volume colony forming units, which are called CFUs, and the best beneficial strains. And if my memory banks serve me rightly, I have done a podcast on oral probiotics and which ones to take and which strains to look out for, and there's probably something over on my website as well. So let's just recap. What are the 6 things you need? Calcium with vitamin D3, with vitamin K2 and magnesium, so we're getting everything in balance. You need your collagen, so you've got your building blocks for your teeth, and then your oral probiotics to make sure the oral cavity has the good bacteria and everything that it needs to help you remineralize your teeth and keep your gums healthy. So if you want fewer cavities, focus on your diet and supplements for having stronger teeth. The best approach for dental health is to actually prevent having problems. This is what I say to a lot of my patients who are new to me, new to my practice. My job, A, is to get their mouth back into health. So that's to deal with any dental infections, dental disease, dental decay, functional problems, cracks, breaks, restorations, and help them then keep it healthy and to prevent them having problems going forward. But we have to work in tandem. You have to play your part. So the best approach to do that is through preventing cavities. Get your dental health on track by reducing foods that promote demineralization, like sugar, grains, and other foods that are high in phytic acid, and increase the foods that promote remineralization, like your healthy fats, grass-fed meats, dark leafy greens, and then use your supplements and then it's possible that you can keep your teeth strong and you can remineralize things before they become too much of a problem and before you actually then need the dentist drill to step in and take charge of the situation for you. But if you have a noticeable cavity, something that you can feel or see, something that can be picked up on an x-ray or seen by the dentist, or you're experiencing tooth pain, or your cavity is deep enough that it might affect the root and eventually lead to a root canal or tooth loss, then you must see the dentist. You must get that tooth treated with a filling. But for prevention and a more holistic approach to your dental care, incorporate the supplements that we've talked about today: your calcium, vitamin D3, vitamin K2, magnesium, collagen, probiotics for your oral cavity, and you may be able to prevent and even reverse your superficial early cavities. I hope you found this useful. I'm Dr. Rachel Hall. I'm a holistic dentist from Brisbane, Australia. I've been working in my practice for many, many years now, and I've got over 30 years experience caring for patients' dental health and well-being at my clinic called Evolve Dental Healing. If you do live in the Brisbane area or you'd like to travel to Brisbane, then give us a call on 0737201811 and we will help you with your dental needs. We provide safe amalgam removal, general dentistry, cosmetic and orthodontic treatments, support you to have a healthy smile for a healthy life. So I hope you found this useful, and I hope that you now understand exactly what supplements that you need to use to have strong, healthy teeth and gums. And until next time, everyone, thanks for joining me. Stay in the zone. You've been listening to the Dental Zone podcast with Dr. Rachel Hall. For health, lifestyle, fitness, and a great smile, get in the zone.